Good afternoon and welcome to the Respectability webinar for today. My name is Kahn-Pauli. I appreciate you taking the chance to join us this afternoon. We're going to be talking about COVID-19, the coronavirus, how it's impacting the disability community, and taking care of ourselves and our mental health in this very trying and uncertain time. So I'm obviously my title is that I am the Policy and Practices Director for Respectability. Our mission is fighting stigmas and advancing opportunities. And I will fully say that I am not a public health expert. I don't typically work on health policy, and I'm certainly not a viral epidemiologist. I played the board game Pandemic a couple times, and that is the sum total of my expertise. So I will be very cognizant of what I don't know, but I do know that we have a vested interest together in, getting accurate information out to the disability community, to our friends out in the world who are being impacted by this very serious situation. As my colleague Eric was just saying, our team in Los Angeles is going to have to find a new event space because it turns out that a place where they were going to have an event tomorrow actually is being shut down because of the virus. So we're all dealing and adapting as best we can. So we've got some wonderful people joining us today. So you've got me, and I work on employment. Joining us from Ernst & Young is Lori Golden. She is a thought leader in the disability inclusion and advocacy, disability inclusion and employment space. She's led some very, really innovative work around mental health in the workplace, managing stress, and she's going to be bringing in that expertise to us today. And because at the end of the day, this is a situation which is very good for, spiking one's anxiety and stress levels, but, really limiting, it's challenging to find what you can concretely work on or do to take care of yourself. Also joining us is Donna Meltzer from the National Association of Councils on Developmental Disabilities. She is the CEO over there. She is a longtime leader in the disability space, and she has members in every state and territories, and getting good information out there is part and parcel of her job. I'm also very excited that the folks from the two people from the Partnership for Inclusive Disaster Strategies, and I apologize if I'm going to mess up your names, but Parodi and Shaylin. How do you say your last name, Shaylin?
Sluzalis.
Sluzalis. Both of them are actually, they're disability rights leaders. They're advocates with significant subject matter expertise in the area of disaster relief, inclusive disaster planning, emergency preparedness for people with disabilities. And thank you, both of you, for joining us. They are the real experts in this space. They have flown to, Puerto Rico to deal with Hurricane Maria. They have been intimately involved in the development of the READY Act, which I hope we can talk about a little bit. They come out of the independent living movement. They are really the experts in this, and I will be deferring to their expertise and talking about their national call to action that they've laid out on COVID and the disability community. But first up, I want to talk to Donna and bring you up first. Here is a quick map of, this is a day old or a couple days old, but it shows that many different states in the country have been impacted by coronavirus. We just, last night I heard the first case in Prince George's County, which is in the DC metro area. And there's just a lot of fear and a lot of panicked toilet paper buying these days. But, Donna, I want to ask you first, what have you been hearing from HHS, from, what information have you been putting out to your membership? Kind of where are your members who represent, the IED community? Just where are we? What is going on? And, what do people need to know from your perspective?
Great. Thank you so much, Philip, for laying that out and asking some really great questions. And I appreciate that you also talked about, you mentioned the word panic. And part of this webinar is to really give you guys some very real information, important information, because I think that when we talk about how to bring down that stress level, a lot of it is when you know information, when you feel secure in the knowledge that you have, some of that stress automatically goes away. There really is no need to panic. There's need to be informed. There's need to take some very important steps in keeping yourself healthy and well as taking care of those who are around you if you are with people who need some extra support and extra information sharing. So again, no need to panic. I know my neighbor told me the other night she had walked into Costco And people were like taking every bottle of water off the shelves. And I looked at it and I said, you know, last I heard, nobody's shutting off my power, you know, my electricity, my gas line, my refrigerator still works and it dispenses water, and my stove and my oven work, and there's plenty of food, and this is not Armageddon. So I think we all need to really start by taking that deep breath and remembering that this is not a panic situation. This is a situation about knowing information and keeping yourselves healthy. And so here at NACDD, at our national offices in Washington, D.C., we have been in multiple meetings over the last 2 weeks with our federal partners, and that includes people at the Administration for Community Living, which is under the Department of Health and Human Services, also the Assistant Secretary's Office on Preparedness and Response, also part of HHS. We've been talking regularly with the CDC, in particular from the Office on Disability and the National Center on Birth Defects and Developmental Disabilities, to be sure that we are, number one, understanding the scope of what this disease is. And when you can understand that better, then you know what protocols to take. And really what the CDC has been very clear in talking to us about is that this disease, COVID-19, is very, very similar to the flu. But there are some important things that you need to think about, both in terms of what do you do and what signs should you look for. So for example, we all know that particularly in the winter months, flu does run rampant. And we know that one of the best ways to manage not getting the flu is to get a vaccine, but we don't have a vaccine, at least not yet, for coronavirus. But the other most important thing that I'm sure you've all been hearing plenty of, because it's real, is wash your hands. And what we're hearing from the experts is you need to wash your hands for at least 20 seconds. Soap and water, does not matter what kind of soap. It doesn't even matter if it's hot water versus cold water. It's the real act of scrubbing and getting those germs off of your hands. So we need to remember to wash frequently, to use hand sanitizer if we need to, because we either can't wash at that moment or we want a little bit of extra protection. I've taken to carrying just a small package of antiseptic wipes with me, so that if I'm around a surface that I'm not familiar with or don't know who's touched it, I might want to wipe down, say, a seat in a metro train or on the bus or wherever you might be. Or when you walk into the supermarket, they're handing out wipes so you can wipe the handle of your cart or your basket that you pick up in the supermarket. So really those very, very simple things are what you do need to follow and remember to do. And staying at home is just fine. Most big meetings have been canceled. I know from our organization, it broke our heart, but every year at this time, we are a co-sponsor along with a number of other national disability organizations of a big conference that brings together about 1,000 individuals to come to Washington for 2 days of learning and discussing policy issues, and then have a day up on the Hill. And we have to cancel it. There's just no question about it. Some people were concerned about the risk of how much money you lose when you have to cancel hotel contracts and food and everything else. But honestly, our thought was the risk of losing money is nowhere close to the risk that people might be put in that could make them sick or even cause death. That was never a question in our minds. So you really have to think about, how do you keep yourself safe? You know, we're hearing a lot about the need to stay away from large meetings or tight spaces where people are very close together. So I think that, you know, from my perspective, from what I'm hearing from the experts, is that it's okay to be in small group offices or meetings, or check in on your loved ones or others in your community. But you don't want to necessarily be in big groups or places where you're very close, like that literally spitting distance. You don't want to be in a situation where somebody's, what comes out of somebody else's mouth could actually reach you. So you want to, no hands, no shaking hands. You know, we're all getting into that little either fist bump or elbow bump, or just a simple greeting of, hi, how are you? It's so nice to see you, but we don't need to be touchy-feely during these times. I think, you know, for us, again, at our National Association, we're trying to push out some really good basic information. We're working with the CDC in terms of getting some materials that are in plain language in particular for people who have intellectual disabilities. Some words are just not part of the everyday lexicon, and so we've asked CDC to put protocols, and I know NIH was coming out with something earlier today as well that just kind of talks about a couple of really important things that you need to keep in mind and that you need to do, like the hand washing, like not going out in public. If you think you're sick, do not go walking into your local drugstore to pick up medication. Do not go to the Minute Clinic. If you think that you're sick, please call your doctor who knows you best, talk about your symptoms, and then let your doctor recommend whether or not you should come into the doctor's office or if you need to go to the emergency room. One of the things that the medical professionals at the CDC also shared is kind of the trajectory. Like if you've ever had a cold, and who amongst us has not had a cold, or the flu, you kind of know that you start getting symptoms, and somewhere around day 5 or 6, you start to feel better, right? The typical cold lasts anywhere from 7 to 10 days. But with coronavirus, it's around that 5th or 6th day that you actually start feeling worse. And if you start feeling something in your chest that is pressing on your chest, that is making it more difficult to breathe, that is when you really want to call your doctor, because you might have been exposed, and that is something that better to get tested and be sure than to be walking around and being a carrier of this disease. I think this is an important point as well. If you are somebody who knows people in your community who are people with disabilities who are living independently, if they don't have somebody who's checking in on them regularly, making sure that they are healthy, that they know what the protocol is, please try to get to them. Check in with people, even if it's just by phone, or if you communicate by cell phone, to give somebody a text just to say, hey, I'm just worrying about you. Is everything okay? If you start to feel sick, or you're afraid, or you don't know what to do, call me. Let me know. I'm here to help. And through our councils on developmental disabilities, we are trying to get all of that information out to folks. Another point that I'd like to make is that, you know, in our disability world, a lot of people are employed as direct support professionals, DSPs. They're often on the front lines. They are the people who are supporting people with disabilities every day, in close circumstances, going into people's homes, helping people, you know, doing everything from taking medication to sometimes needing to support somebody getting out of bed, getting bathed, getting dressed, toileting, etc. So very touchy-feely, very hands-on. So if you are a person who has a DSP, make sure you're having good conversations with them to talk about what might be a little bit different right now. And they should be talking with you about their protocols. The DSPs are getting a lot of education this week from some of their national organizations. The National Alliance for Direct Support Professionals have been doing webinars just like we're doing today. They have provided toolkits for individuals, and other organizations like ANCOR that works with the provider agencies for DSPs has also been doing training. So if you are a DSP, make sure that you're getting access to that information. If you are an individual who relies on a DSP who comes into your home, whether it's daily or on certain days, make sure that you sit down and have conversations to talk about what's what and what's okay, what's not okay. And as you direct your services, that you are having those very important conversations. The last thing that I just want to mention before I turn the microphone over is that, you know, from our point of view as developmental disabilities councils and many others, we work throughout the year at the state level around planning for emergency situations. Now, typically those emergency situations are things like you know, hurricanes and tornadoes and wildfires and so many other things that have been happening in our country, unfortunately on almost a regular basis. But what we've learned in the disability community is that when you're at the table, when your voice is heard and you are making plans, the recovery is faster, the recovery is better, less time for people to lose supports and services or to be without medical care, to be without family, to be without their supports. This situation, of course, is a little bit different because it's sort of upon us, and we have to kind of go through this bell curve almost of waiting for it to hit, and it's sort of hitting in waves in different communities. It hits its peak, and then it will start to come down. And the experts are telling us this bell curve could stretch out for a period of 6 to 8 weeks, maybe in some areas even 12 weeks. We don't quite know yet. But if you are somebody, and I know we're going to hear in this webinar from some real experts in emergency planning, if you know what the plans are in your state or your local areas, follow those protocols. If you have things like a to-go bag packed and ready just in case you need to move someplace else where you feel safer or need more care, or if you do need to make sure that you have enough water, that you have enough food just in case things should take a turn in your particular community, make sure that you're following those protocols. And then, of course, as we all hopefully start to recover, as our nation begins to recover, hopefully just a little bit later this spring, think about some of the responses that you had. How did you feel throughout all of this? What did you learn from all of this? And share that back with us. Let us know. Let those who are doing that state planning, it could be your DD Council, it could be your University Center for Excellence in Developmental Disabilities, it could be the folks who are going to be talking with us in just a few minutes. So make yourself some notes or mental notes or what have you, so that we can learn from this experience, because sadly, I have to say, it might be a first in this kind of experience, but it's not going to be a last. So the more that we know, the better we are prepared, and then the less stress that we will have. So I also just keep encouraging you to breathe, take it easy, be extra kind to yourself, get some rest, keep exercising if that is something that you do regularly, and don't let this take over your life. Just continue to do the things that are important to you and stay healthy. Thank you.
Thank you, Donna. And, you know, we'll get to Lori and the partnerships shortly. And I really appreciate that piece about kind of, I think there's a couple of different dimensions of community health. And I think that, you know, checking in on our, you know, friends and neighbors and coworkers who, you know, may have higher, you know, physical needs and maybe, you know, self-isolating for self-care reasons, you know, I think that piece of checking in on them every day is so important. I will just say that I have a colleague who runs our California work, and, you know, he has a personal care attendant. He has been very diligent about making sure that, you know, he is avoiding outdoor activities, but, you know, that wears on people, and it's important that, you know, we our friends and our coworkers and our loved ones. I also think this is, I'm just going to geek out for a second before I talk to Lori, is I think that information is also a kind of a newer dimension of community health. I mean, I was totally guilty of retweeting a fake news site that claimed the Pope had COVID. So, you know, I realized, oh crap, oh darn, that is not a good website. But, you know, that's the modern information space we live in. You know, getting good information from trusted sources is important. And if you want to kind of a quick primer on the ways that, you know, COVID-19 really, you know, touches on the disability, the unique needs and experiences of the disability community, I highly encourage you to check out Andrew Polrong's recent article in Forbes, which we've got a slide up. Well, the slide has a quick summary of the 5 things you need to know about how this disease is affecting people with disabilities. And, you know, it talks about the health risks, and, you know, it talks about kind of how there's, you know, new perspectives and urgency to long-term disability issues. I mean, how many people with disabilities have been advocating for telework and telelearning for years, and then suddenly, you know, Harvard says we're going to all online classes. So, you know, I think that's a good article to go to and, you know, get yourself educated on these dimensions. And so I want to take a step forward and go to talk to Lori.
Okay.
Lori, you're from I'm going to switch to your bio.
Okay.
You've been a thought leader in diversity and inclusion, and talking about bringing, you know, good mental health practices to the workplace. So I want to touch on kind of the stress and anxiety of what's going on and how we can take care of ourselves before we get to the kind of the preparedness piece.
Thank you, Philip. And I'm going to underscore some of the points that Donna made. And you, Philip, are a case in point as you held up on what not to do. So I've kind of broken this up into 4 key points, some of which are reinforcing, some are a little bit different. The first is keep informed, but not overwhelmed. So when I mentioned Philip is a good case of what not to do, as we all know, it's really important to curate the media that you digest and to learn what sources are neutral and what sources are trusted. Some sources, media outlets that we all go to every day, are in the business of driving traffic through creating headlines. And those headlines, therefore, can be even more alarming than the plain facts might be. So if that's the case, if the local news is saying very, very scary things, then look at your daily local newspaper, look at what the local health department is saying, look at community resources that'll tell you what's going on exactly in your community, but limit your exposure to those that sound histrionic or alarmist. By the same token, we all know people who are, I get confused on glass half empty or glass half full, but people who are really pessimistic and who are downers, the Eeyores in our lives. Limit your exposure to people who talk and think and frame the world that way. Because I'm not saying cut people out of your life, but be self-protective in how you take in information. And no matter what information you take in and from whatever sources, it might be wise to just limit it because too much can be too much and overwhelm even the most practical, well-adjusted person. The other that Donna touched on a lot is take reasonable precautions, and she mentioned some, and some are up on a slide Philip put up, so I'm not going to mention that. And she also mentioned take care of yourself. And I would go one step further and think of it as developing your own personal health care regimen. And it's nothing fancy. It's things like hydrating, even more than you might otherwise. With any kind of illness, that's always a good precaution. Obviously, good nutrition, good sleep hygiene, exercise if you do and if you can. And if you can't, do the next best thing, and that's stretch. And if you can go out and get some fresh air, that's incredibly helpful, both for getting your oxygen going and just in terms of getting endorphins going and being a mood-lifting experience. Make it a practice to take breaks from anything that's overly stressful, whether it's work that's stressful, it's people in your lives and the responsibility. If you're at home with a family that isn't accustomed to being together all day, every day in close quarters, and some of those folks are dependents and have a lot of needs, like children, that in itself can be an added stress, and recognize that. Obviously, you don't want to get away from your children and you want to be there with your family members, but be judicious in how you spend your time. And to the extent you can, take a few minutes of break time to just reset and re-energize. And the other, which is pretty obvious, but can be tempting, at least in some of the more benign ways, is overindulging. Avoid, this isn't a good time to take in harmful substances, nor is it a good time to do things you'll regret, like overeating. and getting into cycles where you feel sluggish and you feel down and disappointed in yourself. So treat yourself like you're in training, not in training to do battle, but in training to be in the best shape you possibly can be, to stay well for those you love and care about, and for yourself. The other thing I'd say is, and Donna mentioned the importance of planning, I'd say have plans A, B, and C. One of those plans is around working at home, or if you have children at home and they need to go to school at home, they need to do classwork virtually. Think about how you're going to prepare for that and carve out space and keep noise and distractions minimized so that everybody can kind of coexist together most comfortably. Plan for the needs of anybody who's depending on you and anyone who lives in your household. That includes pets. It includes elderly family members who may be depending on you, even if they don't live with you. Think about what their needs might be, and to the extent you can, put plans into place so that food, medicine, doctor's visits are available. Any essentials that aren't already in your house. Think about how you can get those. Lots of medicines can be delivered these days. Yes, it costs more money, but our health is worth it. Groceries and a lot of products and a lot of necessities can be delivered. So think in terms of those things. Doctor's visits, lab tests, therapies. Think ahead to what might be in your calendar or coming up days, weeks, or even a few weeks from now, and plan for your contingencies, how you're going to get those things done. At my firm at EY, we have a wonderful benefit where we have access to telemedicine. And if we really need to see a doctor, we won't necessarily need to be able to see the doctor where we're accustomed to seeing. But we have systems that allow us to access a physician, a psychologist, therapist at any time virtually. So think in terms of what you might have available to you and try to put plans in place. The other thing I'd say, the final point, is to proactively manage the stress that you and those in your life may be feeling. The first thing is, and I think Donna pointed to this, reality check your fears. When your mind starts running, and many of ours do, and if you tend to go to worst case scenarios, try to stop yourself, check yourself, and do that for others, and try to reset to what you know is a fact, is actually happening, and stop going to what you may imagine. So you interrupt the cycle of taking the worst to the worst to the worst. Also, deep breathing. It sounds so trite and so incredibly obvious, but there's actually science behind it. When you take regular deep breaths, you are kind of actively interrupting the fight or flight response that leads to panic and increased stress. And what you're actually doing is calming your whole neurological system and sending signals to your brain that it's safe, you're safe, things are okay. And you want to develop habits and patterns that can do that for you as much as possible. And we all have different things that calm us. music. Sometimes calming music, sometimes it could be hard rock that you find soothing. We all groove to a different beat. But whatever you find calming and distracting, think about employing it. Beauty. I find looking at anything that's beautiful, even on my computer, from beautiful photos to artwork, really inspiring and energizing, and it can lift me out of a sort of cloudy mood. Small pleasures. We all have, we call them guilty pleasures. Some of them we need to feel guilty about than others. But whether it's a food that you wouldn't normally eat that you have in your refrigerator and you've been saving and you've had a stressful time and you eat a bit of it, or you sneak some time to watch a television show that you're really ashamed you watch, but makes you feel good, or whatever those small things are, provided they're not harmful to you or anybody else. Take advantage of those small things. We often call them simple joys. Many of us, there was a joke years ago about people looking at cat videos, looking at pet videos, looking at small kids. There is a reason why at the end of your local news segment, and actually national news segment, there's always an uplifting story. So whatever is uplifting to you or inspirational, it can be inspirational short stories or true stories. It can be uplifting movies with happy endings. It can be, I opened the paper this morning and there was a picture of fuzzy chicks, baby chicks, and it made me smile. And it made my heart feel glad. So look for these things. If you're lucky enough to have pets, and those pets are in a total pain all the time, pets can be tremendously calming, rewarding, and relaxing. And there's a lot of good science behind that. A lot of science behind gratitude journals, just thinking about what you're grateful for. To some of us, that's hokey. To some of us, that's very helpful. Creativity. I find doing something creative, making or doing something, creating something out of whole cloth, I find to be really energizing and takes my mind off of what's ever concerning me. And the final thing I'd say is connection. It seems a little bit counterintuitive because on the one hand, we're saying if you don't feel well or have symptoms, don't get too close to people, maybe don't go out of the house, depending. However, keep in mind, the old saw, laughter is the best medicine. Laughing, especially with friends and family, is one of the best things you can do to calm yourself and relieve stress. So when there are opportunities to do that, if you're at home with your family and you can watch a silly movie together or play games together or look at old photos that make you all smile and remember things together, that can be really, really helpful. The other thing is helping people. Many of us find that reaching out to others and giving back is a great way for getting out of our own headsets and our own worries, and making a difference in the world or getting involved in things you care about, whether it's a cause or an organization or it's a political campaign or it's something abstract or just reaching out to an individual who might need support. Anything that takes you out of yourself, not only takes your mind off of your worries, but gives you a sense of agency and control when what all of us are feeling right now is that loss of control, that loss of routine, and that loss of certainties. So, you know, I urge you to kind of think about what makes you feel good, and be really conscious of giving those gifts to yourself, and to those that you love, to try to feel better, and do better.
Gotcha.
Philip?
Well, thank you very much, Lori. And I think that's all very, very simple, but very practical. And, sometimes the simplest things are the hardest and the most important. So thank you for sharing all that. And
Sure.
I would say that last piece really resonated with me in terms of helping others. We may not be able to go out, they may be discouraging you to go out to large crowds, but, we still have, the disability community is very large, very active, and very online. So, we may be able to shut ourselves up in our homes, but we should make sure to keep those social connections alive online. And I keep thinking about I'll just say my wife works with foster care youth in DC, and they're very worried about what's going to happen to all of those families they serve, if school shuts down. And so her organization is already kind of thinking about, well, can we do a book drive or collect board games or do a food drive to help our families in the event that they get shut in for a while. So, I think that last piece of trying to find ways that you can help others is, good self-care and good community care as well. Before I get to our folks from the partnership, I do want to quickly answer two quick questions that came from our audience, and I'll go with the second one first and then the first one second. So the second question we had was, in what ways do you anticipate disability employment to be positively or negatively affected by COVID-19 in the coming months? I'll offer my perspective, and Lori or Donna, if you want to jump in after I say something, please do so. I think, obviously the uncertainty in the marketplace could, this could lead to a recession. I don't want to go that far. It is what it is. I think in the short term, it could be bad because, a lot of people with disabilities end up working in the retail sector, which has a lot of interpersonal contact, not much in the way of, paid sick benefits or sick leave. But in the long term, if more companies realize that telework is a very viable way of, meeting their company needs, getting the work done, being accountable, if a future employee with a disability were to ask for a telework plan in the future, I think that, a lot more companies having a lot more experience using technology to basically ensure productivity in the workplace, I think that could ultimately be beneficial in the longer term. But that's a very long term, much further ahead than we can really look at the moment. And that ties into the second question, the first question, which I don't really have a good answer for. One of our anonymous attendees asked if a workplace doesn't permit working virtually, can this count as a violation of disability rights? I will quickly say that I am not a labor lawyer. I am not an ADA lawyer. I don't know if it would, I know that, failure to provide accommodations is one of the common reasons why things end up in front of the EEOC. I think it would be very dependent on who was the employer, what was the work being done. So I don't have a good answer for that, Anonymous, but that's the answer I have for you. Sorry.
Hey, Philip, this is Lori, I'm not a labor lawyer either, but I'd, add, I certainly agree with everything you said. I'd also add, it depends on the nature of that person's disability. So working from home as an accommodation for a disability is dependent on the disability. If, for example, you are hard of hearing, and you want to stay at home because of COVID-19, being hard of hearing and qualifying, or being deaf for that matter, as a person with disabilities, does not necessarily qualify you to work from home as an accommodation. It needs to directly relate to mitigating the impacts of the disability. If, however, you have rheumatoid arthritis, where the immune system is compromised, and going into a public setting might put you at substantially increased risk, that might be a different story. So my caveat would be, it also depends on the nature of your disability and its impacts. Gotcha.
Donna?
Yeah, let me just jump in as well. And I too am not an employment lawyer, but I think that within the scope of COVID-19, most employers are looking at what their state is telling them, what the CDC is telling. You've heard the terminology of underlying health conditions, right? People who are elderly, people who have underlying health conditions should be taking extra precautions, should be staying home, should be, really mitigating their risk. So I think I can certainly tell you around Washington, D.C., traffic has been incredibly light. Many organizations have given all of their employees the option of working remotely if they feel that their health could be compromised or that they may compromise others. So I think that there's a lot of leniency going on right now, but it may vary state to state depending on, where you live and how many people have been impacted in your state. Are you in a more rural setting, or are you in a city? Are you working in a busy area in a city with, lots of people in an office? I would suggest that if you are a person with a disability who is really concerned about this, have an immediate conversation first with your supervisor and then perhaps with the human resources department. Because what I'm starting to see is a lot of companies, organizations, nonprofits come out with different standards for the duration of this virus, which may be with us for a couple of months, but they're really actually even encouraging people to work from home. Again, as Lori said, it also depends not only on your disability, but what kind of work do you do?
Yes.
And
what kind of business?
And what kind of business, right? So if you're an office worker and everything that you do can easily be done remotely from your computer at home, I think that you're going to, with a simple conversation, get the clearance to work from home. If you, work very front facing in a store, you're working retail, you're working in a, maybe for a factory, a company that, your job is essential every day to be there physically, that might be another story. And then what you want to do is ask the HR department, what is your protocol? What steps are you taking right now to keep your employees safe? I feel like I might be at a higher risk. Can we talk about that?
Gotcha. Thank you. And so we've been talking through everything, and I do not want to neglect Shaylin or German. So I want to thank Lori, I want to thank Donna, and shift gears to really talk about the emergency preparedness piece of it. So for those of you who are not familiar, so German and Shaylin are the co-executive directors of the Partnership for Inclusive Disaster Strategies, which is a really fascinating organization that is at the cutting edge, or whatever metaphor you want to use, of disability inclusion and emergency preparedness. It's very much an evolution out of the leadership of Marcy Roth, who worked at FEMA for many years on responding to disasters and making sure that people with disabilities were not left behind, forgotten, isolated, institutionalized. And the partnership is really, as I said, at the forefront. They are really doing some interesting, fascinating, important work. And I want to thank them for joining us. And I've already talked you up a little bit, so I'm really curious, can you talk to us about what you're doing around COVID-19? You've got a national call to action out there. Wondering if you could talk about that, or talk about ways that our listeners could get involved, donate, or help spread the good word of what you're doing.
Thank you so much, Philip. This is Shaylin Sluzalis, and with me is Parodi. As Philip mentioned, we are the co-executive directors of the Partnership for Inclusive Disaster Strategies. And our organization really does focus on the disability rights, inclusion, and accessibility throughout all phases of disaster operations and emergencies for people with disabilities. With that is, we know that community resilience is only possible when planning, response, and recovery is accessible to all and includes people with disabilities and others with access and functional needs as key members of community preparedness and resilience initiatives before, during, and after disasters. And with that, we also know that people with disabilities are 2 to 4 times more likely to be injured or die during a disaster. And in this case, a public health emergency, which is now declared by the World Health Organization as a pandemic is a type of disaster. So with that, we can anticipate that people with disabilities will be systematically disproportionately impacted during these very unknown and continuously developing times, especially when we have things, as was mentioned earlier, like misinformation, inconsistent information, and fear spreading. So it is important that our communities are getting prepared in this case for systematic disproportionately impacted. So in preparation for and anticipation for that, system advocates, disability organizations, and coalition of disability rights and inclusive emergency management experts came together from across the nation and issued on March 3rd an urgent call to action for immediate strategies and solutions from the federal government and governments at every level, including local, state, tribal, and territorial, to address the specific needs of people with disabilities throughout the COVID-19 outbreak and all public health emergencies. And this national call to action really calls upon the emergency and health strategists to address continuity of services for people with disabilities who require them for their health and daily functioning, access to actionable information for people who require accessible forms of communication, including vision or hearing disabilities, intellectual and developmental, cognitive learning, hearing, reading, and information processing disabilities, ensuring that daily needs of people with disabilities are met for food, housing, healthcare, and community support, which are provided by personal caregivers or community agencies. We also mentioned how to operationalize, the living arrangements throughout quarantines that potentially may be particularly burdensome for people with disabilities and their families. And also to ensure that access to necessary tests and protective equipment is available, not only to people with disabilities, but to their caregivers and takers. And the provision of training for agencies and their employees in their legal obligations with regards to people with disabilities, and including and in communicating with disability community leader subject matter experts. So we know that there is a workforce crisis already existing before COVID-19 started in regards to direct support workers, personal care attendants. And we do fear that this COVID-19, this health emergency, may dramatically exacerbate the workforce crisis. So we were really calling upon the government to take systematic actions to be as prepared as possible to respond to people with disabilities and the inclusion of people with disabilities at the planning table, that voices are being heard, as well as needs and rights being met and those legal obligations being fulfilled. So actions that we can take, as Donna mentioned earlier, talking to your local public health officials, your state emergency managers, disability related providers, ask them questions. What are their contingency plans and continuity of operations plans? How to address in-home and community-based services and supports if workers do get sick or don't feel safe, if the consumer does not feel safe, the person with a disability, or simply if somebody does not have a support network, what are those plans for those people that may fall through the gaps? So asking your local, state providers, state agencies, emergency managers, asking those questions of what are continuity of operations for things like home and community-based services, accessible communication, and access to medications, the things that are very vital to daily independent living needs in the community. Some legislative advocacy that we could bring light to as system advocates and advocates in the disability community is there has been since June of 2019 a bill called the Ready for Disasters Act, and Ready stands for Real Emergency Access for Aging and Disability Inclusion. And those bill numbers are HR 3208 and S 1755. And the Ready for Disasters Act really does address a myriad of disability related issues in disasters, but specifically from the COVID-19 outbreak, pieces that we could start advocating for in our communities with our congressional leaders is federal funding for nonprofits and centers for independent living to do the work that we are all doing now for community preparedness, information and referral, response requests, those things that are happening because we know they need to happen, or people will fall through the cracks, but may not be federally funded or funded in any matter with financial support. So READY would address that issue specific to disaster and emergency related response for nonprofit organizations, as well as the training and technical assistance for funding if this comes in, that if federal agencies come in, like we are seeing at the National Guard in New York, starting to come in. If this outbreak becomes to the extreme of needing more federal agencies involved in filling these gaps, such as in-home supports and services, that they have the proper training and technical assistance to understand self-determination and people with disabilities rights, and just properly working alongside of people with disabilities. So we encourage folks to take the Ready for Disasters Act to their state legislators, to Congress, and to advocate that these pieces could be replicated in your local area, and certainly we are advocating for them on a federal level. There are other legislative efforts underway for things like paid sick leave. I'm not entirely sure if that would cover consumer-directed personal assistance services, but we have not seen specific legislation on the needs and rights of people with disabilities in disasters or public health emergencies, and Ready for Disasters Act does begin that discussion. So, of course, as everyone has mentioned, getting personally prepared as if any other disaster is coming to knock on your door. Get your plans out and dust it off the shelf. Start communicating with your community support network, your friends, family, support workers, and the community about what your plans are in all scenarios, and especially in the worst case scenarios, so that you know that you have a plan in place with the community around you, and of course advocating on a systematic level as well for that.
Definitely. And Shaylin, I just want to quickly interject. I've included in the chat box, I've included a couple links that give some background on the Ready link, as well as the sign-on letter for the partnership's national call to action. And I will say that, just this morning, the Consortium of Citizens with Disabilities had a membership meeting to talk about some of the advocacy around the House Democrats' proposal on paid sick leave for workers impacted by this crisis. So I know that there are advocates that are pushing to make sure the DSPs are included. But it's an evolving situation, and as Rahm Emanuel once said, let no crisis go unused. So, or he said something like that, but I really appreciate it. And I was going to say, is Shaylin, the partnership has responded to a wide range of different emergency situations before. So I'm kind of curious, can you kind of take a step back and talk to us about kind of the scope of work that you've done, and what are some other things you're working on?
Yes, absolutely. The partnership was created in, as you mentioned earlier, with the lead of Marcy Roth, who was previously at FEMA's Office of Disability Integration and Coordination. And through that, actually, the partnership was formed out of Portlight Strategies, which is an organization that focuses on response and the need for disaster and disability inclusion in the response efforts of disasters. So Portlight Strategies has been around since 1996 and has been responding to things as wide as the Iraq War, to Haiti, and to Hurricane Maria most recently, where Herman and I began to get involved as Portlight Strategies asked us to deploy to Puerto Rico after Hurricane Maria, and specifically focusing on the needs and rights of people with disabilities and reaching the folks that are in the most remote areas that may not be able to get to distribution points, to the food and water that may be coming down the street, but folks that aren't able to get out of their home to get that. We really focus on filling the gaps and the needs that are there, that we're able to identify with our partners across the nation. So we have many partners that help us do all of the great work that we do to provide durable medical equipment and consumable medical supplies after disasters. We were most recently in the Bahamas after Hurricane Dorian, providing relief and durable medical equipment and consumable medical supplies to keep people independent at home with dignity and respect and independence. We also have national disability rights stakeholder calls on a weekly basis on Tuesdays, where we encourage many stakeholders from emergency management levels to community organizers and advocates to get in a discussion on how best to prepare, what is disability inclusion in emergency management and disaster planning, and the before, during, and after piece. So we focus on all aspects of a disaster and emergencies, all aspects of, and all disabilities, all ages, all children, and just any type of disaster related need in regards to people with disabilities. We try to fill those gaps, fill those needs. And with that is also our disaster hotline that we have available to the nation. That number is 800-626-4959. And we encourage folks to reach out to us in any area of the country that is impacted by any disaster with any disability related need. And we will work with individuals to connect them with the resources that can fill those needs.
Thank you so much. And I know that we're running kind of towards the end of the hour that we had blocked off. I will make sure that both links to the scope of the partnership's resources, as well as copies of this slide, get distributed to everybody who is online today. So for our audience, I just wanted to quickly give a shout out. I know you've already asked a couple questions. If there were any other further questions that our audience was burning to ask, now is the time to do so. What steps should people take if they need to move states with a disability during this time? That's a big one. Of course, it would depend on the person's disability or their need, and I think that it's one of those questions for kind of the family members of is now the right time to be making a drastic choice or decision like that. Do any of our panelists want to add to that, or?
This is Herman from the partnership, and to those of us that are Medicaid or dependent, we need to understand that it does not cross states. So if you are looking at that, perhaps calling a DD council in that state or a Center for Independent Living in that state to begin addressing that. And for the sake of time, in the ready.com website, you will also find information of the Disaster Relief Medicaid Act, which completely covers in disasters having Medicaid follow the person across states. It is a big issue, but just to know that if you do have Medicare, that does cross state lines. And surely ACL's website has more information on this, and CDC, but that is a great issue to be aware of.
Yes, and thank you for that. And it goes back to the point of we want to make sure we have good information, and we're trusted sources from CDC directly, from ACL, from the DD councils, from your state and local providers. Not random social media accounts that are unverified. We got a different question from Sudi. I'm not going to try and butcher your last name. Apologies. We offer many lab type courses, and campus may decide to keep those courses running. What steps do you think that we should take for the safety of our students, staff, and faculty if they do stay on? I mean, I think we kind of already touched on it in terms of, remember, wash your hands for at least 20 seconds, pick whatever song you want to sing it while you're washing your hands, scrub very thoroughly. If you can get your hands on it, hand sanitizer is kind of important. It is, killing the virus requires precautions and safety. If any of the students, staff, or faculty start showing signs of a fever or cough, encouraging them to work from home. I know that may not be possible if, say, it's a lab course where you're actually, growing fungi in a lab or something, but I'd say having a buddy system might be a good idea where, everybody's responsible for everybody else. And, if you haven't heard from somebody in a day or two, check in on them. That community health piece of, checking in on everybody and making sure that we're all doing what we need to do to take care of ourselves and others is important. Anybody else want to offer anything else for Sudi? All right, there being none, I am going to say thank you so much for our panelists. Thank you all for joining us and lending us your expertise, your insights. Thank you all of us who joined us for the webinar today. I hope that you have, taken away the key message of don't panic, wash your hands, take care of yourself, practice good self-care, get good information, share resources, sign on to that call to action, learn about the READY Act, and maybe there's some legislative opportunities out of this crisis. And let's kill the virus, and remember to call our mothers and take care of everybody, okay?
That's great. And I love the suggestion to sing happy birthday to the ADA when washing your hands. Thank you.
There we go. Happy
Caroline,
birthday,
Kim,
ADA.
and whoever else. Thank you.
All
Thanks
right.
for a great opportunity, Philip. We appreciate respectability.
And thank you everyone who joined us today.